Happy Thursday, everybody. You guys are doing terrifically. Thank you to those who have reached out. You've been terrific. I think most everyone's on target now and getting rolling and getting started. So thank you very much. Welcome to office hours number 3. This is a review of Unit 3, our Medical 1. A couple of things I want you to keep in mind. Biggest thing is, remember, when we're talking medical, this unit that you've just done and the next unit and what we're going to be teaching during next week's office hours, we're talking about a disaster. This is not everyday stuff. Your kid skins a knee, or God forbid, you come across somebody that needs CPR or something like that. This is a disaster in a situation where the number of victims or survivors outnumbers the rescuers, us, right? And so how do we handle that sort of thing? So some of the stuff today is going to be useful to you in your everyday life with your kids and your husband and your wife and whomever. And then some things would be more appropriate for a disaster type of situation. If you happen to have a pair of exam gloves accessible to you, you might want to grab a pair because it'll just be more fun to participate in class. If we were in person in the classroom, we'd be handing out gloves to everybody to practice with, but that'll have to wait till skills day. But like everything else in life, practice helps, makes it easier. So if you have a pair, it is good practice to do, and we're about to do that. I'm also wearing, in case you haven't noticed, a CERT t-shirt. And starting next week, the CERT store will be featuring t-shirts, long sleeve and short sleeve, as well as all the usual stuff. So if you're interested, there's no stress, there's no pressure. Remember, don't worry. But if you would like some team wear, now that you're halfway through, congratulations, your CERT course, then by all means, take a look at the CERT store, and I'll send you the information, the link, and all the details on that. But the t-shirts are only for sale at certain times, certain windows during the year, and that's going to start the window's going to open next Monday, and I'll send you an email with the details. All right. So today you get to meet another one of your now fellow CERTs. She's been a long time CERT member. She's an EMT, and her name is Pauline Perry. She's one of our trainers, and I want to welcome her and thank her so much for giving us some time today to go through Medical 1 with you. So first, let's get started just very quickly. Are there any questions from your experience this week that we need to make sure that we cover? Make sure you put any questions in the Q&A box as we're going. And thank you also to Casey Treadway, my colleague, who's facilitating as usual tonight, and she'll be watching the Q&A box for any questions that come in. So don't hesitate if you have a question related to Unit 1 or Part 1 of medical. Okay. All right. So without further ado, let me introduce you to Pauline Perry. Thank you so much for your help tonight. I'll be here the whole time, and we'll get rolling. All yours, Pauline.
Hi, everyone. Thank you, Sandra, for the introduction. And I want to just thank all of you for joining this program, because it really is an important program. It'll come in handy many times during your lifetime, even if you're not even thinking about it. So we want to make sure that tonight we talk about things that will keep you safe and help you throughout this process. Sanitation measures, that's why Sandra's been asking you to get the exam gloves out. We're going to talk about PPE. We're going to do, I think his name is Bob, right?
We'll call him Bob.
Bob here is going to be our patient, and we're going to do a head-to-toe assessment on him. And we're going to learn to recognize and perform the treatments that are needed for heat and cold related injuries. If you were in Texas lately, you would have needed this information. So you never know when that's going to happen, and Texans weren't expecting it. No. Even Portland, I have a plant up in Portland, and they had blizzard. They had a blizzard and they didn't have any supplies. So we're learning things as we go along. And we're gonna teach you or show you how a tourniquet works and when to use it. Okay, let me see if I can figure out how to move this along.
Give me a sec. I don't know how that happened, but okay.
Okay.
So try that button next.
Okay, all right. All right, for those of you who have gloves, why don't you put them on? I don't think donning is the problem. Doffing is the problem. So we're gonna put these on. And so when you're using these gloves, you're probably gonna be touching something that you don't wanna touch with your skin. So obviously you wanna take them off because they've become dirty and you don't want to touch anything. You don't want it to touch your hand or any part of your body. So
I'm going to stop you for a second.
Okay.
Ask you to step over. What I'm going to do is I'm going to stop sharing so that you can see this on the big screen. Okay, gang? So hold on. If I can find my stop share button. Stop share. There we go. So then people can see your gloves.
God, I'm so glad you're here. So anyway, you have blood on your hands or something on your hands that you don't want to get on your skin. So what you're going to do is you're going to take one hand and pull the palm part of the other one off of your finger and do it slowly, because if you have a lot of blood or some kind of liquid on there, you don't want it to snap and go into your face. So then you just roll it up into your palm and then put your finger of that same hand that you just took it off of underneath the inside of the other glove and pull it off. So now all you have is the inside of the glove that you took off last. And then what are you going to do with it? You're going to put it into a red biohazard bag.
What if I don't have a red biohazard bag, Colleen?
We're going to put it someplace,
Plastic bag.
someplace so that nobody's going to touch it.
Right.
So anyway, okay, now we want to share again.
Yep. Because that's tricky.
Just
Hey,
that.
Sandra.
Yes,
We actually already have some Q&As in the chat if you're ready.
go for it.
So someone asked, just curious, what exactly would happen if a limb with frostbite is massaged? Would it damage the blood vessels or what?
What was that?
So it's frostbite. So why do we not massage with frostbite?
Oh, you don't want to massage with frostbite because sometimes there's ice crystals. If it gets that cold, there's ice crystals in the blood. And when you rub or move something too much, that one of those ice crystals could go to the heart, and that wouldn't be good. Did I screw this up?
Nope, you did
Oh,
not.
okay.
Everything's perfect. So we've done donning and doffing.
Right.
Okay, that answered that. Was there another question? Go ahead, Casey.
There was. How many pairs of gloves should we carry, given that we should not reuse gloves across potential victims?
That's a really good question. And in your bag, you should have multiple pairs of gloves because in these kind of situations, you don't know how many people you're going to be seeing. If I usually taught triage when we were doing our skills back in the day. And I used to always tell people, when you're doing something in a multi-casualty situation, always put on 2 pairs of gloves. That way you can take the top one off if you touch somebody and you need to change gloves, and you don't have to, and you have another pair underneath. And you could even add another pair onto that bottom one, because putting on gloves over sweaty hands is almost impossible, especially in a situation like that. So you should always wear a couple of pairs of gloves. And if you're doing work, you may even want to put your work gloves over those 2 sets of exam gloves. Does that answer your question? I guess so.
I'll see if there's any follow-up, but for now,
Okay.
we'll assume that it is.
Any other questions, Casey?
No other questions on that.
This
Go
one?
ahead. Mhm.
Oh, wait, sorry, one just came in.
Just came in. Hold on.
Is there a video that we can watch that illustrates the body positioning when opening the airway?
We'll be showing you that in a little while, if that'll help, but is there a video that you have?
So videos on Zoom don't always work that well. So we will send you some videos that we'll be talking about tonight. And I will see if there's a good one for you on showing the airway, but there will be a demo on that tonight as well.
And that's it for now.
Okay, this probably was not in the online course, but we've always taught this here at San Mateo Consolidated, and it's about the 3 killers. And the 3 killers are airway, bleeding, and shock. And why is that? Airway, if you don't have a patent airway and you're not breathing, that's a killer. And if you're bleeding and bleeding excessively, you could bleed out in a few minutes. And shock really means that your blood is not circulating throughout your body correctly, and eventually it may take a little bit longer than bleeding out, but that will be a killer also. So remember those 3 things, and we'll talk about all of them today. Okay, let's see if we can move this. Okay, personal protective equipment. You might have heard PPE. That's what this is. And you all know who the most important person on scene is. It's you. So you have to protect yourself, because if you come to the scene and something happens to you, you're no help to your patient or your victim. So you make sure that you are protected first of all. And we've all heard most of this in the last year. Wash your hands frequently or use sanitizer. Wear non-latex gloves, and non-latex is important because a lot of people are allergic to latex. So you don't want to bring something that is an allergen to your patient to them. So make sure that if you do go and get gloves and you have them in your bag, that they are probably nitrile is probably the best. N95 masks, we've all heard about masks and N95 and how we were told not to wear N95 so we could save them for all of the healthcare workers during this pandemic, but now there's more available. So you probably should have 1 or 2 in your bag. Just remember, it's not a one-time use. You can use them over a period of several hours, but if you're not using it continuously, you can put it out in the sun, or and it will you can use it over and over again. Not all the time, but for a few hours. Goggles are important because if you do come across someone who has an arterial bleed, that blood is going to squirt, and you don't want it in your eyes. Or even if it's a serious bleed, you might get it on your hands, and it might go in your face. So just wearing goggles, they're cheap and they will take care of your eyes. Or even if you come across something that's not blood, but it could be some kind of chemical or dust or something like that, it'll help you with that. Sterile dressings are good to have. There's also dressings that you can buy that are non-sterile, but if you come across someone with an infection or something like that, sterile is the best. So if you're going to keep something in your bag, try and get the sterile.
So this is non-sterile, and then sterile would be
Yeah.
sealed.
These are non-sterile dressings, but the sterile dressings are all packaged separately, so that you have to tear open the package in order to get it. So that's how you'll know the difference between sterile and non-sterile. But if you don't have anything else, this will work. And avoid contact with body fluids if you can, especially if you don't have gloves on or any kind of personal protective equipment. I've heard this over and over again, and it sticks. If it's warm and not yours, don't touch it. So that's something to remember. If you come across someone who is on the ground, or someone like Bob here who's laying on the table or on the floor, make sure that you approach from an angle that he can see you. because you don't want to come from behind, because then he can't see you and you might scare him, or he might think that you're someone that's going to hurt them. So approach from the front or from the side so that they can see you and identify yourself. Hi, my name's Pauline. I'm from San Mateo Consolidated CERT. May I help you? Ask permission. If they are unconscious, of course, they're not going to answer you, but it's going to be implied consent. So you can, you're just thinking, if they were conscious, they would probably allow me to help them. Same thing kind of goes for children. If there's no parent around, you can imply that the parent would want you to help them. And of course, respect cultural differences. I learned this very early. I had a patient who had a hijab on, is that what you call it? And she fell and had hit her head. So I had to check her head and I had to take it off. And the person who was with her said, be sure you put that back on before anybody sees her. So you have to respect those things and learn what they expect. Okay, head to toe assessment. We're going to talk to Bob here.
Talk to Bob, yay.
Yeah.
So you move that way.
Okay.
I'll move this way. All right, so we have to move the camera, so don't get dizzy. So let me stop sharing first of all. All right, and then I'm going to move the camera. So if you want to close your eyes for just a second until we do that, and you'll get to meet Bob. So exciting. And we're going to turn this so that the microphone is facing you and you can see what everybody else is seeing. Okay, here we go with the camera. All right, here's Bob.
This is Bob. So I'm going to come up to him and I'm going to say, hey, Bob, I'm Pauline. Can I help you? I'm from San Mateo CERT. And of course, he's going to say yes. So, so I'm going to talk to him while I'm doing this the whole time through. So I'm going to say, I'm going to touch your head and I'm going to just feel to see if I feel anything that's, I would be wearing gloves, by the way.
Thank you.
Yeah. Feel if there's, and I call it DCAP-BTLS, deformities, contusions.
There's a slide on it coming up, yes.
Yeah, okay. So I'm going to feel for all that. And I'm also going to keep checking my gloves to see if there's any blood on my gloves. And I'm going to look in his ears and in his eyes, see if there's any raccoon eyes or any blood or anything coming from his nose. I'm going to open his mouth and see if there's anything blocking the airway, like if there's any loose teeth or anything like that. And then I'm going to go down to the neck and just go across the collarbone and see if I feel any DCAP-BTLS. And then I'm going to go down the sternum and the chest to see if that feels intact. When I get to the chest, I'm also going to hold it like this and push in to see if everything moves at the same time. And if he is conscious, I'll ask him to take a deep breath and to see if both sides of his chest rise and fall at the same time. I usually do the arms last, but you can do these in a different order if you want. So this is the abdomen, and the abdomen is in four quadrants. So I'm going to take my hand and push on all four quadrants. All this time I'm telling him what I'm doing, and if I hear anything from him like, ouch, I'm gonna ask him about it, but I'm not gonna push anymore. So see if there's any it feels hard or anything like that. So that would indicate some kind of internal bleeding. Then we'll get to the hips, and I'm gonna push in and up and see if that feels like it's stable. Because sometimes if there's a hip, a broken hip of some kind, one side will be different than the other. And then I'm going to go down the legs and see if I feel any of those DCAP-BTLSs. And you can't be real, you have to push. You have to push to see if you can feel anything. And then I'm going to check his feet, ask him to push and pull on my hand. He has no feet.
Bob doesn't have feet, but yes, imagine the feet.
And then I'm going to go up and do the arms. do the same thing on the arms. And
So
while-
it's important to have a system,
yeah,
head to toe. And then, as you said, you come back and you do the
Yeah.
arms last, but that is your system.
yeah. I know, and I'll usually, because Bob is here and I can't go around,
Mhm.
I would usually go around
Okay.
because I can get a better feel for him. Okay, Bob, you're doing great. Now, what part didn't I touch yet?
Okay.
His back.
Ah.
So we have to be careful with that because if we suspect that he has some kind of a spinal injury, we don't want to tweak it.
Mhm.
So first of all, what I would do is put my hand down here in the small of his back
Hold on.
And-
Let's see if we can.
here
Hold on. See the small. Yeah.
and up here under the neck where I can get my arm in. See if there's any blood. If not, and especially if I have a partner, and if I suspect a spinal injury, I would want my partner to hold his head and we would turn him at the same time. So they would hold his head, count it out, and we look up here and then I could feel his back.
And what are you checking for on the back?
Any DCAP-BTLS. Okay. Are there any questions?
While you're thinking of questions, I'm putting the camera back. So everybody, close your eyes.
Let's see if Bob has anything in his pocket.
Ah.
All right, Sandra, I got one for you if you're ready.
Go ahead.
They're asking, what if Bob is too heavy to roll?
But well. So hang on. Insert. You would be out with your team. So there will be at least 3 of you working together. And of course, if you're in a mass casualty incident, you would have a lot of survivors to have to check. But you would get to a point if you wanted to rotate someone where you'd have to ask for your partners to join you and assist you with that.
So yeah, so doing a 2-person role is possible, or more people if they needed.
The more, yes, the more the merrier is very true, and you definitely want to
I wouldn't move anybody Bob's size by myself.
yeah. So again, better safe than sorry. So if you have any suspicion that there could be a neck injury or some sort of spinal injury, you definitely want to work with multiple people. 3, I would say at minimum for an adult-sized man.
But Bob is pretty light, so we could move it.
He's very fit. Yes.
Yes. Okay. So once you have done your head to toe and you have if you found any kind of injury or if you need to do any kind of treatment, you have to document it, because if you didn't document it, it didn't happen. So one of the people who are with you should be documenting as you go along so that you don't forget things.
And Pauline, we actually have a question related to that, asking, do we record their health info? And I think if so, where do you record that?
We have a form for that, right?
We have a form for everything.
We have a form for that.
However, if you don't have
Yeah.
the form, write it down
Yeah,
on paper.
on a piece of paper, and you should have that in your backpack. Sometimes you might, if you're going into a multi-casualty situation like that, it's a good idea to stick a piece of tape on your leg and then just write on that. So then you don't have to fiddle around with paper and it's easy to see. But
And then later transfer.
yeah, and then later transfer it to, and hand the chief piece of tape.
And
Okay.
Pauline, what kind of health info do we want to be jotting down? Probably like blood pressure, heart rate.
Oh, no, not in a multi-casualty situation. You want to see what did you see here, and what types of injuries that will need immediate attention, and what can wait. And we'll learn about triage next week.
Yes.
And it's a 30-second thing. You don't have time, and you probably don't carry a blood pressure cuff anyway. So yeah,
That's
no.
not part of our.
No. Yeah. if you happen to be a nurse or a doctor or an EMT and you have one, that's one thing, but you don't do it in a multi-casualty situation. Just like in triage, if you find someone who is not breathing and you adjust the airway, you do not do CPR. It sounds terrible, it sounds horrible, but you have a lot of other people to get to, and you need to make sure, I keep forgetting to look at you guys. And you need to get to everybody, because everybody might need, someone over here might need help that you can help them with, and you're dealing with someone who you probably won't be able to save.
We'll
So
cover that next week.
Yeah.
In triage, absolutely.
30 seconds. Okay, here we are, DCAP-BTLS. So there's pictures here. You can see exactly what they look like. That deformity, I mean, something that doesn't look normal. Contusion is like a bruise. Abrasion is like road rash. Punctures, well, it's like if someone gets a bullet wound would be a puncture, or if somebody got poked with an
Pencil.
ice pick or pencil.
Do they have that?
Burns, we all know what burns are. Tenderness, so when you're doing this head to toe assessment and he says, ow, you know that that's tender. So that might be something to look into. So that's something for you to document. Lacerations are cuts, and swelling, we know what swelling is. So it's something that's sticking out that isn't supposed to be sticking out. There you go. So when and where do we do assessments? If you're in a building that has light damage, and you can assess the person right there because you're not in any danger of the building collapsing or a fire or anything like that, that's fine. If something is moderate damage, you would probably want to move them first and then treat. You know what we do with heavily damaged buildings, or places we don't go in at all. So, but if you hear somebody in there or something, you need to document that so that the other first responders know that they need to go in there and rescue somebody. Or if somebody tells you that there's somebody in there, you need to document that, but you do not go in there. We'll learn again next week that you assess and tag everyone, and we'll talk more about that next week. And we did talk about being verbal while you're doing that head to toe, and making sure that not only are you saying it so that your partner knows what to write down, but also so that the patient can hear you. Even if he's unconscious, that somehow in the back of their brain, they may be hearing something. So you should always talk even if they are unconscious. Okay. Look, listen, and feel. That is a good one, because even if you're not sure if they're breathing, they're unconscious and they're very still, and you can't tell if they're really breathing or not. If you look at their chest, you might see it rise and fall. Listen and put your ear to their mouth, and you can maybe feel, first of all, you can feel if they're breathing, and you can hear it. So look, listen, and feel is really important. We talked about checking your hands at all the time, so that you can, I touched something, oh, it's bleeding, where did I get that? So, oh yeah, I stuck my hand under his back, that's probably it. So yeah, check your gloves all the time. And we talked about if the spinal injury, you got to be really careful. And like I said, if you have to turn him to check his back, if they're really big and you're afraid that you're going to hurt them, I probably would just try and feel under there. But yeah, you have to be very careful with a suspected spinal injury. If nobody saw what happened, then you don't know. So you have to be careful. And if you do move them with 2 or 3 people.
Hey, Pauline, we got a question that came in that said, but if someone is bleeding, shouldn't we stay and apply pressure? Or should we stick to the 30-second and go method?
We'll learn that next week again. There are two different situations where you would stop and treat. And the only two are opening an airway, open it twice, see if and we'll learn about head tilt, head tilt, chin lift in a little bit. And the other one is bleeding. So a lot of, well, we'll get into that. You can use some other people to help you with hold pressure, or sometimes the patient can help you hold pressure so that you can get to everybody else. But yes, those two situations are important. Check pulse, motor, and sensation. So when you're doing your head to toe, we couldn't do it here on Bob because he has no hands and feet, but you would check his pulse. There is a pulse on the foot, and there's a pulse on the wrist, but there's also pulses in different places. On the brachial artery is here, but you would check. It's best to do it on the appendages, the feet and the hands, so that way you know that blood is getting all the way to those parts. Pulse, motor, that's why I said we would ask him to move his feet up and down, and then you can ask him if he can feel. Can you feel which toe I'm touching? And if he says, no, my little toe, and you're touching the big toe, then maybe he's just guessing. So ask him those questions if he's conscious. If he's not, there's really nothing you can do for that. The only thing you can do is check for pulse. And also, while you're going through that, looking for a medical alert, bracelets, necklaces. Some people have tattoos. So look around, and if you see anything like that, make sure that you take a look at it, read it, see what it says, because there's different reasons for having a medical alert bracelet, and it might give you a clue why they might be unconscious or something like that. So take a look for that. That's important. Okay, this is the order of assessment, but like I said, some people do it in a little different order. As long as you get everything in there, it's important to get to all of it. And sometimes some people will do one side and then go on the other side and do the other side, but make sure that you get it all. And it's really important, I would say, to get the core done first. So start at the head and work your way down, and then the arms and legs whenever you fit them in your system.
But develop a consistent.
Do it
the same way each time.
You do it the same way every time. So here we are with the spinal injuries. Do no harm. That's rule number one. Try not to move their head and neck. If you do have to move it, make sure you have a partner who's holding his head, and you and your other partner move him. And when you do that, the person who has control of his head is the one who's in charge, because otherwise somebody's going to say, okay, 3, let's move. No, the guy at the head is the one who's going to say, all right, we're going to move on 3 and we're going to move to the right. So everybody is on the same page and everybody's moving in the same direction. So your goal is to keep his neck and spine all in one line, so that you're not going to do any harm that way. Bleeding. Arterial bleed. This is what we were talking about. That's the squirting one. The blood is coming directly from the heart. So the heart is pumping that blood. So it's got a lot of pressure behind it. So if you hit an artery, it's going to pulse out. That's how you can tell it's an arterial bleed. And those are the ones that are the most serious, because you can lose blood the fastest. And so if there's any kind of an arterial bleed, you got to get some pressure on it right now. And then we'll learn a little bit later about tourniquets. You might want to use a tourniquet. Venous bleeding is blood actually that's coming back to the heart, so it's not under all that pressure. But you can get some serious venous bleeding. You can lose a lot of blood. It just doesn't come out as fast. So you can have serious trouble with venous bleeding also. Capillary bleeding is just an oozing. So kind of like a road rash or something like that. So this picture always reminds me of worms coming out of somebody's hand. I don't know about that picture, but Anyway, so that's the 3 different kinds of bleeding. And like I said, arterial bleeding is the one you really want to watch out for. Work fast. Oh, and here we are with tourniquets.
There you go.
So I think we have one here.
So you can have this.
Okay, this is a,
So I'm gonna actually stop sharing so they can see the
Okay.
bigger screen.
oh yeah, that's
Give me
right.
a second.
And Sandra, while you're doing that, Pauline,
Yes.
do you mind answering this question of what happened to using pressure points above where direct pressure is being applied for arterial or heavy venous bleeding? I didn't see any mention of that in the online training.
That used to be in the training. They took it out, I don't know why. But not only the pressure points and it's also elevation, they took that out too.
Did they really?
Yeah,
Oh, God, okay.
but
We
yeah,
don't keep
that
it- we don't keep
works,
it in,
that works. So I wouldn't forget about it. If you can't get it stopped with direct pressure, then push, you can find a pressure point above where the bleed is, say it's on the arm, and there's a pressure point right here where the brachial artery is. And if you press that, a lot of times you got to press hard and push it against the bone, it'll stop the flow of blood. It's kind of like a finger tourniquet. And another thing that'll help is raising it above the level of the heart, and that will also help. But if that doesn't work, tourniquet is the way to go. This is a manufactured tourniquet. One that, yeah, it's called the CAT, developed by the military. So I don't know how, if you can see this.
Yeah.
So
And,
it's,
another question, Pauline.
Sure.
With the using the finger to be to stop the bleed, shouldn't they always do that before tourniquet? They're
I
asking
would,
the
I
tourniquet
would,
be
for
a last
sure.
resort because of the risk of losing a limb, correct?
Right, right. So this is a tourniquet, and
Hold it up here
oh,
so they can see it. Yeah.
so this comes apart, but it's fed through this thing right here. So you put the arm or whatever in
You
here.
want me to be you want me to be your arm?
Okay.
Okay. I'll be the arm.
So you put it on there, and then you bring it. You don't have to bring it too tight. All this Velcro.
Yes, it
It's
is.
sticky. Let me just do it this way. Velcro
And
stick.
still sticks too. There you go.
Okay. And
Oh, yeah.
then, yeah. And then you turn this thing here, and it tightens it up. I don't want to go too
That's
tight.
all right.
Okay. When you get it, when the bleeding stops or slows significantly, then you put this rod into this
Lock.
lock, and it stays there. And then there's another Velcro thing that goes over there, and it says time. And what you're going to do is you're going to write the time down. That's really important for the hospital to know, because they want to know how long the tourniquet has stopped the bleeding in this part of the arm, so that they know if it's safe and when they can take it off.
I'll take it.
You do not take it off. It has to be taken off at a hospital. So you can use a tourniquet like this if you happen to have one. You can use other things if you happen to be somewhere and someone is bleeding out and you don't have one. You could use a belt, or if you have a, what do you call it, a triangular bandage, and you fold it and to about a 2-inch line, and you can use that. But don't use anything too thin, like you don't want to use a shoestring or something like that. You need something that's a little bit thicker, wider. So the reason you don't want to take it off is because the blood in the lower part of the arm that's being stopped becomes toxic. And once you release it, all that toxic blood is going into the body, and it could cause more problems for the patient. So let them take it off at the hospital. And Yes, they will look at the time that's on there, but if you don't have one of those, and even if you do, if you put a T on the forehead, as soon as they get to the hospital, the nurses and doctors will notice that, and they will know to look for a tourniquet in case they don't see it. Tourniquets can be put, don't put it on the neck to stop bleeding but they can be used all on appendages. You can use two if you have a person who's a bigger person who you can't stop. You can't just.
I think if you go forward, there's a picture of that.
Oh, okay. All right, we'll go for. Oh, where's share screen?
Pauline, we got another question for you.
Okay.
Someone's asking about something called clotting powder that they would dump on a wound to stop bleeding. Is this still a thing, or did it not work out?
Yes, it is. I think it is in this, isn't it? I wasn't. See, I've been reading a lot of different things.
Yes, and it's hard to remember what's in and what's not, but respond to the question.
Yes, yes, it is. And that's another thing that was developed by the military, and it has some kind of, I'm not sure exactly what it is, but it has something on it. It's actually clotting powder. I don't know. They have, it's on gauze, and they sprinkle this powder on the gauze. It's a commercial. Hemostatic dressing.
Yes.
And you can stick it in the wound, and it has something in it that stops the bleeding. So yes, that is a thing, and anybody can buy it. It's not something that you need a prescription for or anything like that.
Let me see. I think here we go.
Okay, there you go.
And then the next slide has a double too.
So you can put two on if you have someone who's big. You can put it over clothes, but don't put it over. He has it over his shorts here, but if they have like jackets and all kinds of heavy things like that, don't use it on that, because you can't crank it down enough to stop the bleeding. So only on
It's directly on skin. And
Yeah.
you don't want to do it on a joint. That's what they're saying.
Right.
Don't do it on a joint above the joint.
above or below the joint, or whichever.
And then next step.
Okay, there it is. And it says it should be tight enough so that the tips of three fingers can't slide under the band. So
Pretty snug.
it is.
Mhm.
So why do you need to take quick action when someone is bleeding? Phase 1 here, it says death within minutes. That's a severe trauma. Well, we all heard about Tiger Woods the other day. If someone hadn't seen that crash, he did have severe bleeding in his leg, and he could have bled out. So that's very important. And it took him a while to get him out of the car. So just that's why quick action. Death within several hours. If you have an arterial bleed for sure, or even a deep gash with venous bleeding, you could bleed out within a couple of hours. And then death within days or weeks, that's infection, because infection can set in even if you try to be really sterile, but you're out in the woods, and things can get in there. And if you don't have clean hands, or it can happen very quickly. And then septic shock can set in, and the whole body is full of infection. So we have to be quick action, but also try and be as clean as possible.
So Pauline, you brought up the question regarding Tiger. We have someone who's asking, what is the best way to stop bleeding for fractures that break the skin where direct pressure is a bad idea?
No,
Ooh, yeah.
no, just try and stop the bleeding as best you can, but no direct pressure. You might try raising the leg, or I don't know why I thought it was a leg, but might try raising the limb, or try using the artery to stop the flow of blood to that area of the limb, or if you have to, it's a tourniquet. Okay, there's different kinds of shock. The one we usually talk about is in red here. It's the hypovolemic shock. That's the loss of blood. But there are other kinds of shock, and we need to treat that as just as much. Cardiogenic shock, as you can imagine, it has to do with the heart, and so it's the inability of the heart to pump blood. So if the heart is not pumping blood efficiently, and the blood is not getting to all the cells and the organs, then the person is going to go into shock. Neurogenic shock is an injury to the spinal cord. So that's another thing why you have to be very careful with moving people who might have a spinal cord injury. Anaphylactic shock is an allergic reaction. Well, we've been hearing a lot about people with anaphylactic shock reactions to the vaccine. Very few. But that's what they're looking for, and that's why everybody who has the vaccine has to wait to make sure that nothing happens. And I don't want anybody to feel that that's going to happen, because it's very, very, very rare. But it's just something that they're being very careful about. Septic shock is when there's a widespread infection throughout the entire body, and that's what we were talking about before, and that could lead to death within days or weeks. So ineffective circulation of the blood, and just like I said, and it leads to the death of cells and entire organs. And so when the blood, if that blood isn't getting there, it's bad news. So how do we tell if someone's in shock? 32 can do. That's easy to remember because it rhymes. And RPM, I learned RPM, but it's pretty much the same thing. So let's talk about 32 can do. So you're going to look at the person and you're going to say 30. What am I looking for 30? Rapid or shallow breathing? How are they breathing? Are they breathing faster than 30 times a minute? Now, I'm not going to sit there for my 30 seconds that I have with this patient and count how many times they're breathing, because that would waste my time. You can tell. That's too fast. That's someone who's breathing more than 30 times a minute. So you can tell if they're not breathing normally, and you can tell when they're breathing too fast. 2, that's talking about capillary refill. Now we're going to talk about capillary refill. Can you I can.
Close to the camera.
Okay, I'm going to touch my fingernail bed and squeeze it, and when I let it go, it's going to be white, and then it's going to turn red. I don't know how quickly you're going to be able to see that over the computer, but if it turns red back before 2 seconds, then perfusion is good. So
you guys can do this at home as well, because I know that was a little bit, it was too close to the ring light, so it was a little blown out. Brightness, so
okay.
Try it on yourself at home.
Yeah, just push in your nail bed, and it'll be white, and then it'll turn red. So that means the blood, because you pushed it, the blood is going away from your fingernail, and then when you let it go, the blood is going back into your finger.
But what about if you have a manicure?
I'm stepping. Yes.
Okay.
That's what exactly what I was going to say. All right. So if you have a manicure, or your survivor has a manicure, so a couple other places you can check here on the fatty part of your hand. That sometimes can change color. For some people, on their earlobe. I don't know if you have any other tips, but these are other places you can check. Again, you want to see the color come back within 2 seconds, and that tells you that that bleeding is normal and everything is functioning properly. If it takes longer than 2 seconds for the color to return, there's an issue internally. Sorry.
I've never done it, but some people say you can do it on the lip also.
Okay.
And Pauline, we actually have a question on that. Why does the Blanche test not work on children? Or why is it not a reliable determinant?
I've never heard the reason for why it doesn't work on children. I know it doesn't work in the cold, because blood is flowing slower because of the cold, but I don't really know why. We could see if we could find out, though.
Yep.
Maybe I'll come back next week and remind me. And then can do it is trying to show mentation. Ask a simple question, ask a question you know the answer to, have them follow a simple command. Just don't ask them what their name is because you don't know what their name is. My son's a paramedic and he asked one of his patients and he said, he said, what's your name? And the guy said, Jesus. And he goes, no, what does your mom call you? And he says, Jesus Christ. Well, maybe she did name him Jesus Christ. That could be true, but he didn't know that. So then he had to go to a different question. So, or have them follow a command. Now you might have someone who doesn't understand English or can't hear. So a lot of times if you hold out your hand and they'll grab it, or if you grab their hand and squeeze it, they'll squeeze back. So try those little tricks to find out if they can follow commands. Okay, treating shock. Put the person down on the ground. The reason we like to do that is because if they do start getting woozy or going unconscious, they're not going to fall. So lay them on their back. And if you can get something underneath their legs to lift their legs up, what this is good for is because then the blood that's in their legs and in their lower extremity can go into their core. And that's where you want the blood to go because you want to make sure the blood gets to the heart and to the lungs and to the brain. Make sure that he has an open airway. Go and check, make sure he's breathing. If you talk to him, if a person's talking, that usually means they have a patent airway, but just make sure that if they're not talking, that they are breathing. You might have to do the head tilt chin lift to make sure that they are. If there is serious bleeding, do direct pressure, try and get that bleeding stopped because that's making the shock worse. So try and maintain that, control that bleeding. It's really important to keep them warm. So if they're on like a concrete floor or even on the floor of a room, if it's not, you know, down there it's colder than up here. So try and put something underneath them and on top of them to keep their body temperature up as much as you can. Yeah, try not to mishandle them and just try and keep them calm because that's you know, there's another shock. It's called psychogenic shock. Some people go into psychogenic shock because they just get nervous. And so that keeping people calm in any kind of situation is really important. Oh, the recovery position. Okay, can I do it on him?
He won't do it. So we can discuss it and the video that's on there, I will send it to them.
Okay.
So they can watch it.
All right.
But under what circumstances do we use the recovery and why?
Okay. If someone is unconscious but breathing, you need to leave them to go and call 911. You would put them in a recovery position because in case if they're on their back and you're not there, if they start to vomit or something like that, you don't want them to choke themselves. Or just it's a good position for them to breathe in, even if they have any kind of respiratory issue. People with respiratory issues do not like to be laying down flat because it's harder for them to breathe. So I think you probably saw the video on the virtual part of the class, but yeah, just try and easily. And if it's a big person, get your partner to help you to do it. And are there any questions on that or anything else? There it is. And it's important when you do put them in the recovery position that you have that face going down because in case they do vomit, it's gonna come out and not stay in their mouth and choke them. Cold. This is where the people in Texas would have been good to know this.
Hey, Pauline, I know you asked, but we have a question. Someone asking, is it just me or did the video not match the order of the quiz answers for the recovery position?
It did not. They told you to put him on his side first. And yeah, I noticed that this time too. I didn't notice it at the beginning, but yeah. The way they tell you in the video is right, but the order is wrong. And that's why I couldn't pass that test the first few times. So yes, she's right, or he's right.
So the video we'll send you, I believe, will be correct.
Yeah. Frostbite. So this is frostbite is nothing to laugh about. People can lose limbs, and especially earlobes, feet, hands, fingers, toes. Those are the things that usually get attacked because they aren't getting as much blood flow. If anything is wet when you're in the cold, it makes it even worse. So first thing you need to do is get them out of the cold environment. Get them in a car, get them in a cabin, get them in the house, whatever you can do to get them out of that area. Now, sometimes if you're way out in the country, it might be difficult, but try and get them out of the cold environment, even if you have to huddle together and keep them warm. But hopefully you won't be in that disastrous position. So if you get them inside, immerse the injured part in water, not hot water. I think they said like 104 degrees. So just warm, and do it slowly. So, and keep track of the temperature as it cools down, add more warm water. If you do have to go out again, don't thaw out a part if you have to go out again, because refreezing a part is, you're almost gonna lose it. You're not gonna save that part. So and again, don't massage it. I think we talked about that because of the ice crystals that might form in the blood. Oops. So we don't want those ice crystals to go to the heart, because that would damage the heart. And after you thaw it out and you get it to more body temperature, wrap it in towels or blankets or anything to keep it warm until the person gets back to their normal feeling. Heat exhaustion. Yeah.
They said 107.6, which sounds way too hot. They're commenting.
Yeah.
Those sound very hot.
Yes, I thought I saw 104. We'll check on that too.
Yeah, a note to feedback for the class.
Okay, heat exhaustion. This is, more than just going out and taking a walk in the sun. This is working in the heat and profuse sweating. I had a patient one day that we went in this room he was in. The temperature was about 100 degrees in the room. He came out, he was way up high. He came out and his clothes were so wet that I could wring them out. And I said, did somebody throw water on you? He said, no, that was just his sweating. So he's lost all of that cooling in his body. He was still sweating, which was good. So we took him out. We took all the wet clothes off. We put cool compresses on him, and we were fanning him so that he could cool off. But he went to the hospital, and of course we gave him something to drink, and the electrolyte water is the best. But if you just have water is good. So he's got to replace all that water in his system. So just make sure that you keep him cool. You can put cold compresses or ice bags under his armpits, in between his legs. Oh, that's for heat stroke, which is the same thing. You can do that for both. Heat stroke is very serious. Some people die of heat stroke. So if someone gets to that point, they'll not be sweating. They'll be dry. And that's because they don't have any more water in their body to sweat. So that's a really important thing to make sure you get water and electrolytes into them and make sure they cool down. Sometimes even putting them in if you have a bathtub, it depends on where you are, but putting them up to their neck in a cool bathtub. So again, not cold, not freezing, but just, regular room temperature. Yeah, people with heat stroke might not even be conscious. They might be very altered, may not be able to move their arms and legs as they thought they could, and might be hallucinating. So they're out of it. They need help right now. So it says ABCs. So that's airway, breathing, circulation. Check all those things. Are they breathing? Check cap refill and make sure that everything is working correctly and get them cooled down. Yeah, no alcohol, nothing like that. Just water. And just keep track of them. Any questions? Ooh,
We have
Nothing so far, but give them a second to type.
okay. And then we'll do
we
head
have to
tilt,
do the-
chin
We
lift.
have to do the chin lift on this game.
Yeah.
And then I have stuff to talk about.
Okay.
So we can go ahead
I'm
and do
not
that.
seeing anything, so if you want to go ahead and set up, I'll keep an eye on it.
Okay.
Okay, so we're gonna stop sharing here for a sec, and then we get to move the camera again, so we don't want anybody getting dizzy. Hold on. All right, stand by, we'll move the camera. All right.
Okay, this is for,
Nope, hold on, I made it. Can you hold this for this now? Thank you. Let's go this way. This
I
mic-
don't know if this guy has a name.
I didn't name him.
Okay.
You can name him.
Okay, this is if someone is not breathing, especially, well, anytime. So the first thing to do is check to see if they have a patent airway, if they can get air through. Because sometimes when people are unconscious, their tongue will just let loose and it might block the airway. So in order to get the tongue away from that airway, tilt the head back, head tilt, and then push up on the chin. Don't push down here. You want to push on the bony part of the chin. So head tilt, chin lift, and that should pull the tongue up out of the way of the airway. It didn't show jaw thrust, did it?
No, but you can discuss that. If you
Okay.
suspect, yeah.
If you suspect spinal injury and you don't want to be moving their head, you can use the jaw thrust method, which is, it's hard to show on this guy, but if you know the angle of your jaw up here, if you push that forward, so you're gonna push it forward, he doesn't move.
He's not, yeah, he's
He
not.
doesn't move, but if you push it forward, that will also lift the tongue out of the way and it won't compromise the spine.
Right, the idea with the jaw thrust is not to move the neck, right?
Right.
Okay. All right, I'm putting the camera back, so hang on, everybody. All right. Okay. How we doing, gang? Everybody good?
We did get 2 questions.
All right, go ahead.
So one is saying the unit did demo the jaw technique.
Good.
Okay. Answer live. And then is jaw thrust less reliable?
I don't know that it's less reliable, but it's not as easy to do successfully, which is why it's a second option. The chin lift is much more obvious.
And
But-
it's easier to have someone else help you with that rather than pushing the.
And right, as Pauline was saying, it's easier to have someone else assist you with that or hold the head in position, Because if you come across someone who's not breathing and you open the airway with a head tilt, chin lift, chin lift, they're going to drop down again as soon as you let them go. So having someone else hold them in that position will maintain the airway open. So a few things.
Oh,
Yeah, go ahead.
no, just the comment saying thank you for that.
Oh, absolutely. Yeah. So a few things. These are nitrile gloves. Let me see if I can make it. No. All right. The light is very bright. So nitrile gloves. And these, for example, come in a nice blue color, the ones that you saw that Pauline was using as well. They come in different colors, and you'll see even black ones. We don't recommend black simply because it's when you're checking and you're looking for blood on your hands, it's harder to see. So whatever nitrile gloves you happen to decide to get for yourself, any color lighter is probably better, just so that you can see what's happening there. Okay, I wanted to point that out. Also want to remind you that what we're discussing is in a mass casualty incident, right? A lot of victims with potential issues that you have to sort and deal with, and that's what we'll be discussing in detail next week. But if you come across, obviously, someone who's not breathing and you open their airway, you can focus all your attention on the one person, a family member or a coworker or whatever. You're going to focus all your attention on that one person, and you're going to call 911. So anything that we learned tonight is useful in every day-to-day incident. But if it's a mass casualty incident in which the victims outnumber the rescuers and 911 is already being called to a gazillion different locations, that's when you're going to have to make some difficult decisions, and that's when you're going to have to use more urgent methods. And what you're learning here is in a mass disaster, a catastrophic situation. Does that make sense? However, the skills you're learning are useful to you in day-to-day life. Let me go back to sharing. All right, so there's that. Okay, so for next week, keep in mind that next week, you're going to be doing, through this week, you're going to be doing Unit 4, which is Disaster Medical Part 2. There's a video at the home base, which I'll go over here in just a moment to show you. We're going to ask you to watch that video called the START video prior to our office hours next Thursday, because that'll give you a really good primer on what triage is all about. And again, what we're going to be discussing next week is not covered in Online CERT. So remember that our hybrid CERT is several parts. Online CERT, which is the whole FEMA curriculum. It's what everybody is learning throughout the country. That's consistent. The office hours that we're doing, take that information and localize it, and you learn the important things that are important to us and our area, the types of injuries, types of disasters, the type of processes that we go through here. And triage is not being taught nationally, but is used here in the Bay Area and throughout California by professional responders and CERT teams. So we want you to have the benefit of learning triage specifically, and that's what we'll be doing in the office hours next week. So it won't be review. By all means, you can ask any questions you need to ask, but be sure you're here and tell all your friends, make sure they attend next Thursday's class, because that is going to be a new process that you're going to be taught next week. All right, so I wanted to be sure you had that. So let me, yep.
We have another question that came in. Are there effective ways to reduce potential queasiness around massive amounts of blood loss?
Wow, queasiness for the rescuer or for the victim. So, wow. If it's for the rescuer, that's definitely. It's funny. My daughter loves all those true crime and very gory and what is it, the Walking Dead and all those shows. I go, you'd be great in an emergency situation because you've already seen all the awful stuff that Hollywood can imagine. So so that again, and that's it's personal. Don't feel badly if you're not the kind of person who can do that. You'd be surprised what you can do in an emergency. So I'm not going to tell you that it's going to be pretty. It's not. And
There's a job for everyone.
And there's a job for everyone. That's right. So we're exposing you to all the different things and different options and the training that is CERT. But when it comes down to it and you're done with the basic training, you're going to find your niche. You're going to find what you like to do and what you do best. Medical could be for some, and then it could be search and rescue for others. It could be documentation for others. That's fine. Don't worry. There's a job for everybody. We will find one for you. But right now, it's important to learn all the different aspects of it. So queasiness, well, we were talking about shock, and I want to emphasize shock again because of the three killers, it is the least obvious, the one that is often overlooked. And a person can be in shock because they just received horrible news. They just discovered a family member had died or something like that. And that, I mean, I've had that kind of shock myself, so I understand how it feels. It's very scary. You totally lose control. In my case, I passed out. So fortunately, I had people around me very quickly who reacted and brought me back to and settled me down, and I took it easy for the rest of the day. But shock is just as urgent a need for treatment than the others, the airway and breathing. It's all, it may take longer to develop. And that's one of the reasons you ask about, simple command. Can they squeeze your hand, or can they respond when you talk to them? Because you can tell that gives you an idea of if their mental state, if they're changing. Perhaps somebody's in great shape and they're answering you and they're talking. But then a few minutes later, you look over and you're like, squeeze my hand, and they can't do it anymore, or they can't tell you what day it was or what they had for breakfast. A person's status can change. And again, we'll be discussing that in triage next week. But that's why you're constantly sort of assessing. Remember the assessment, the size up, right? You're doing that with everything that you do, including when you're treating a victim who's possibly injured or at least has gone through some sort of a disaster. All right.
Sandra, the person is clarifying that yes, the rescuer, and they're telling that like when they're treating someone, they're totally fine doing it, but when the adrenaline subsides, they're very sick. And the only thing they found so far is that saltine crackers.
Yeah, I agree. In my experience, I have been very good at the time of the emergency. I've had situations with my own children, which have been very scary. At the moment, I react well. I get everything done. I call 911. I'm able to get all the information. I'm able to assess everything. And then in my case, we were in the ambulance, and then we got to the emergency room and I answered all the questions. And then off she goes with the emergency doctors, and I sit down. And it was my first moment to sit down. And all of a sudden I got very shaky. All the adrenaline hit. And I started to think of all the things that could have gone wrong. And did I do everything right? And you start to really sort of freak out. And that's normal. Don't worry. That's normal. It's your body's way of getting rid of all that excess energy. And again, everybody handles things differently. There is no right or wrong. Remember, we talked in psychology last week. There is no right way or wrong way to handle a disaster emotionally or psychologically. So your body's going to react the way it reacts. Expect that. Tell yourself that it's normal. Saltine crackers are great. And then let it subside. But yeah, it does happen. Absolutely. Let me stop sharing again and find the right page that I do want to share with you. Let's see if I can. So if we go to you should all be familiar with this page. Casey, are you seeing that?
Yep, following along.
Thank you. So then you go to new students. This is your home base page. Now remember, you should be looking at your essential documents, which are here in class 1. So this rose colored box is your essential documents. So make sure that you're working through these. You should have them almost all done. And then make sure you start on IS 315.A, which is an online class through FEMA, which is specifically for CERT, and it covers ICS, or the Incident Command System. And we want to make sure that you complete that before you can go to your skills day. So these are the things that have to be done before you're allowed to take your skills day, when you are able to take your skills day, which we're working our way forward. We're now in the red tier, which is great, right? We're in the red tier. Then we'll hopefully, if we keep doing what we're doing with masks and distancing and washing our hands and taking care of one another, we'll move into the orange tier and then into the yellow tier. And once we get into the yellow tier, we can schedule skills day. So that's what we're hoping for. But what I wanted to show you is class 4. So class 4 is what we're going to be doing, aiming for next week. And if you go to class 4, here is a video called the Start video. Please take a look at that prior to next Thursday, because we'll be referring to it from time to time, and we want to not assume. We want to make sure that you've actually seen it, because it will make much more sense to you then. All right. And the other thing I wanted to remind you is the gloves. So the whole donning and doffing, removing of gloves is tricky. And the idea here, again, is to keep you safe by keeping the bad stuff off of your own skin. So that's why it's important to learn to remove gloves in a way that does not touch your skin. If you were in class with us, you'd all have a pair of gloves, you'd put them on, and then I would spray your hands with shaving cream. So you can do this at home. Take the shaving cream, and then your hands are full of shaving cream. Imagine the shaving cream are bodily fluids that are not yours. And you don't want to get that shaving cream on your skin. So practice taking off the gloves. This is not easy, folks. Practice taking off the gloves without getting any shaving cream on your skin. And again, like anything else, practice makes perfect, right? Pauline's suggestion was excellent in terms of wearing a couple of pairs of gloves. So if you're coming upon, again, you're activated with your CERT team, you know you're going to a mass casualty incident, so you want to start prepping as you're on your way there. Put on 2 or 3 pairs of gloves, and then your work gloves over them, and you're ready for anything. And then as you move from patient to patient, you will remove the outer pair of gloves safely, and then you'll have a pair of clean gloves for the next patient. Remember, every patient, every victim you're touching, new pair of gloves, right? Fresh pair of gloves. In a perfect world. Go ahead.
We got a bunch of questions that came through.
Here we go.
So one is, does the IS 315A course have a prereq class that are necessary to take?
No.
Okay, great.
No. Don't worry. Yeah, go for it.
And then, do we send the essential documents to you via email?
Thank you for asking that question. I forgot to address that. Do not send me anything. Hold on to everything. Hold on to your merits. Hold on to any certificate you earn. Hold on to all that, because once we set a skills day, that's when I'm going to need certain materials from you, and I will be asking for you specifically. In order for you to sign up for skills day, you'll need to have those things completed. So make sure that anything that you do complete, anything that you earn, you have it stored and ready to go, because that's when I will need it. But don't send it to me now. I'll lose it and it'll be a mess. But hold on to it, because those are your receipts. Absolutely.
The other question we got is someone asking if you could run through getting to that page again, if you have time for it though. So if you don't, I can just...
I'm happy to do it. So let's just back up in time here. So this is our home base. This is for us here at San Mateo Consolidated Fire Department CERT. Remember, if anyone asks you what your sponsoring agency is, San Mateo Consolidated Fire Department is your sponsoring agency. That is the CERT team that you are working with, right? To become fully certified in CERT, you need to complete Online CERT. You need to complete the IS 315A class. You need to, sorry, you need to attend the office hours, and you need to complete the hands-on portion, which is the skills day. So then you're full on. Don't worry, we're walking through it. It seems like a lot. It's a big lift, I know it. But we have 800 of your neighbors who are active certs now, and over 2,000 in all 3 cities who have taken and gotten through this course. You can too, and you're doing great. So hang in there. Small bites, small chunks, we're gonna get through it all. And a lot of people have described the CERT program as like trying to drink water from a fire hose. Yes, it's a lot of information, but what does Sandra always say? Don't worry. You will get another chance to experience it. You'll have another chance to review it. We have, after you've finished the hybrid CERT course, you'll have the opportunity to take continuing education classes with us. In fact, just last week, we had a class on building damage assessment when we talk about a lightly or moderately or heavily damaged building and how to decide that, because that helps us as CERT decide, is that a building that I can go into or not? And therefore I can assess, size it up, and decide. So this is our home base page that we're looking at right now, smcfire.org/CERT. And there's a lot of information on this page. When you have a moment, you can go through it. But your most important button right now is New Students. And this takes you to our overview. These are all of our classes in the order in which we're doing them, and how, and additional information. Remember, if you were in a classroom with me right now, we would be giving you handouts, we'd be showing you the videos, we'd automatically be localizing stuff. But since we can't do that in this situation, no worries. We're dividing it up and creating the hybrid CERT program so you can do the online CERT, which gives you all the curriculum required by FEMA. And then we're doing the office hours so we can localize that information to the way we do things here. All right, so we've just completed class 3, which is part 1. But what's going to happen, and I'm showing you class 3 because I add on Tuesday of next week, I'll add this for unit 4. But I put here under references, I put a study guide. So if you have a problem because something was a little discombobulated in online CERT or something didn't make sense and you have a problem getting through it, the study guide will get you through it. But for this next week, we're in class 4, Disaster Medical Part 2. And what I'm asking is that you go to this video and play this video on your computer, and you can be prepared for next week's class. And in the reference section next Tuesday, I will add the study guide for class 4, for unit 4. I hope that was a clear enough walkthrough.
It was great. And if anyone has any questions about it, reach out to us. I also posted directly in the chat the link to take you to that rose-colored essential documents box. Okay. We did get one more that came in asking about what you said earlier with the gloves. So yeah. What is the storage life of gloves and how often should they replace them in prep kits?
Wow, excellent. You guys are so good. So later in the course, I'm going to have one of our experienced certs show you his or her backpack. And remember, if you are in our jurisdiction, when you graduate CERT, you'll receive a backpack with some basic tools and basic supplies. But over the course of time, each individual CERT finds what works for them and what they like to have in their bag. Again, their CERT bag, separate from their go bag, which might be separate from their first aid kit. So, we become bag people here on CERT, but the CERT bag, we definitely want to have gloves. Now, of course, in every kit, every bag you have, everything that you have, we're now adding masks and hand sanitizer, right? Masks and hand sanitizer and everything that you've got. But in your CERT bag, gloves will certainly go there. One of our certs who was one of the ones who demoed his bag last time would take the gloves and he'd roll them all together and he'd put them in a baggie and he'd have like several pairs. So he'd roll them up into pairs. So all he had to do is pull out a roll and he knew there was 2 gloves in that roll. And he would carry, you know, maybe 10 pairs in his backpack. So as far as when they do break apart, they do dry out. So once you take them out of open the box, if you will, I don't know. Have you had experience? We usually go through the gloves pretty quickly, but I'd say after.
I did have a box that I had on my desk in the sun, and they deteriorated pretty fast. So I would keep them in a dry, dark place.
So dry, dark place, as far as where you keep it, like in a closet, for example, is a good spot to maintain them. But I'd say I would check them once a year.
Yeah.
I check them once a year to be sure they're
They
still.
don't actually have an expiration date.
Yeah, you're right. I don't think there's an expiration date because again, it depends on how they're stored and how often they're used. Because in a medical setting, for example, they go through gloves like nothing. But in our case, we put them inside a plastic bag and roll them up and put them in our backpack and forget about it. So I certainly would check them about once a year. And I try to remind our certs to go through their backpacks about once a year.
And that's all we got for right now, Sandra. So you're good to go.
All right. So you guys are doing fantastically. Keep up the great work. Get in touch with me through cert@smcfire.org if there is anything that comes up unexpectedly. But you're halfway through. I mean, come on, give yourselves a hand. That's fantastic. So again, don't worry. I know Skills Day is on the brain. It's for me too. We're trying very much hoping that we're going to be able to do actually several Skills Days this calendar year so that we can get everybody completed in CERT. So that's what we're really hoping for. But getting this training that you're having right now, like Pauline said, this is the kind of stuff that will help you in day-to-day life. Hopefully it won't be in a disaster situation, but if there is one, it's great to know that I have additional neighbors who are prepared to address things in their way. Remember, we're going to talk about this some more, but remember when you're acting as a CERT team, you want to be acting within the scope of your training. If you happen to have medical training, if you're a doctor or an EMT or something like that, and you're in a CERT team, you still will work within the scope of CERT. You will not stop and treat someone as a doctor or as a nurse. And we will discuss that again. That breaks the chain and that breaks up the team. So we have to work within the scope of our training. And that's important. So what you're learning is fantastic and will certainly be of great use to you personally, to your family. And remember that the priority in CERT is you. And we want you to take care of yourself, your family, your home, and your immediate neighbors. After that, if you are available, if everything in your life is settled and taken care of, and you're able to help the greater community, that's when you can come out and meet up with your fellow CERTs and get formed into teams and help out the community in that way. All right. Everybody have a great week. Don't forget to watch the start video. I will remind you of that. If anybody's missed any of our office hours, I'm posting those on our YouTube channel. And the easiest way to get to that is to go to youtube.com and then type in the search box, type in San Mateo Consolidated Fire Department, and it'll come up to our channel. And one of the playlist items is the hybrid CERT course, and you can see all of our hybrid CERT office hours. All right. Everyone have a fantastic week. Be safe, and thanks so much for all you do.